Hello everyone and welcome to this training. It is a free training for healthcare assistants and nursing assistants that want to work in the UK. Okay, on this training we're going to be having like 20 different sessions. Okay, and on these 20 different sessions, each section will be addressing a particular topic. Okay, just to give you an understanding and a basic background knowledge you need to have before you can attend an interview for the role of a healthcare assistant or a nursing assistant. Okay, on these particular videos, I said 20. Each of them will be addressing different topics. As you have applied for the job of a healthcare assistant, you will have to also attend an interview, and during the interview, the interviewer or the panel, they will be posing questions to you just to check and see how well you understand your role, how well you can perform on this task that is ahead of you. So it is important that you have all this information and you check out all our videos. Get ready, bring out your barrels and your pens and your notepad, because it's going to be a long lecture, all right, so that you will have the basic knowledge to be able to defend and perform well during the interview. The interviewers are going to be asking you scenario-based questions. They're going to be giving you scenario-based situations and expecting you to react in the way a good and a professional healthcare assistant will. Okay, so the purpose of this training is for you to be aware of how to answer those questions. We're going to be giving you a practical view. We're going to be giving you theoretical view, so that in the end of this training, you will be able to be prepared for any kind of possible interview. We'll try our best to give you possible scenario-based situations that you might be confronted with during your interview. Okay, so the purpose of this training is so that during your interviews, which is the most important part of the job application, you'll be able to perform well. Like I said, after you have applied for your jobs, you will be shortlisted for interview, and during the interview, the interviewers, the panel, they want to check if you meet the basic requirement for them to even take you into their team. And like I've said in previous videos, when you're offered the job and you are about to start, they're going to be doing induction and on-the-job training for you. Okay, those are the core things that you require to be able to perform well on your job. Let's be clear, this training is strictly a personal online learning resource for you. It is not what qualifies you to be a healthcare assistant. It is just a video that educates you, that informs you, so that when you are confronted with some interview questions, you'll be able to answer very well during your interview. And that can give you a high chance of convincing your interviewer that you are well positioned to take on the job or take on the role of a healthcare assistant. Okay? So very quickly, I'm going to be going into the training now. So I advise you to get your pen, your notepads ready, because we're going to be spending almost a few hour, okay, maybe like 1 hour or so on this video, because I'm really going to be analyzing and explaining to you, giving you possible scenarios, okay, that shows how you can respond, and giving you how ways and patterns the questions can come during the interview. Okay, so for this particular training, the topic of this training is your role as a healthcare assistant. What is your role as a healthcare assistant? That is a very common question. I've been privileged to be part of an interview panel, different interview panels, and I've understand how the interviewer is looking out, what they are looking out for during the interview. So in this training, I'm going to be putting you through on what to expect, and I'm going to be giving you in details the type of instructions that you need to follow, okay, so that you'll be able to be in the right frame of mind, and you'll be able to respond to questions that can come up during your interview. All right, so the topic we're addressing now is understanding your role as a healthcare assistant and as a nursing assistant, as a healthcare worker in the UK. All right, so we're going to be moving on. So for those of you that like topics, let's name this particular topic. All right, let's call it understanding your role as a healthcare assistant in the UK. All right, now, a role of a care worker or care assistant is to support people, okay, with all the aspects of their day-to-day life. Okay, now who are you supporting? You can be supporting an elderly person, you can be supporting somebody who is just recovering from surgery, you can be supporting somebody who is towards their end of life. It could be a palliative patient, somebody who is probably going through chemotherapy, somebody who is going through maybe a cancer patient, somebody who is probably having a mental disability or a mental illness, or having one disability or the other. Okay, so but the key role that is important as a healthcare worker is that your responsibility is to support people with all aspects of their day-to-day activities. Now imagine you as a person, what are the things you will do on a normal day? What is your daily routine? Okay, now your role as a healthcare assistant is to be able to help somebody who can't do all these things by themselves. The things you would normally do on a daily basis, like wake up in the morning, freshen up, get yourself ready for the day. Sometimes some people, when they wake up, the first thing they do is to use the restroom and get themselves refreshed. And so this is the typical example of what you would like to do. So imagine yourself being somebody that needs the help of someone else, okay, because you can't do these things yourself. You are probably because you are ill, or you have some challenge or the other, some physical challenge or the other. So imagine someone else doing it for you. So your basic role as a healthcare assistant, okay, is to be able to support the person that you are asked to take care of, the patient being the person you're asked to take care of in this case, with their every aspect of their day-to-day life. Now, you might be working in different setting, okay? It could be in a care home, it could be at somebody's home, it could also be within the community. Okay, you have to support them with their social and physical activities. All right, this could include, sometimes it could be eating, it could be drinking. Some of them might want to use the gym. You have to help them, help them to they might need some physiotherapy. They might have some physiotherapy schedule on their care plan. For example, care plan will be talking about what that one means in our subsequent training session. Okay, now you could be eating and drinking, like I said. You could be attending appointments with the doctor. Some of them have hospital appointment to see maybe their doctor. You will be helping them to get by. Go there and make sure that their appointment is each free, to make sure that their appointment goes smoothly. Okay, some of them would need help in shopping and sometimes in money management. Okay, like I said in our other videos, you also understand what it means to understand privacy and dignity of your patient, because you have to manage their money on their behalf. Some of them, they can't go to the supermarket by themselves to shop for groceries. They will give you a list of things they want. You will go and shop for them. Okay, so in your role as a healthcare assistant, these are things that you will be doing. Okay, you also have to understand that some of them might need to be going for regular medical checkup. Some of them would need you to maybe wash them and dress for them. Some of them will need you to maybe book the appointments for them. Some of them would need you to help them when they are going for their appointment. Some of them can need help. Maybe they have a dressing on a wound. In the case where it is not so complicated, you might just help them with that. In some cases, the nurses will come to do that for them. All right, but it is important that the things that you are not trained for, you don't do. Okay, this will be contained in the things they will teach you during your induction and on the job training after you get the job. Some other things that you also need to be doing as a healthcare assistant is you have to monitor the individual's condition. Okay, in some cases, you monitor their blood pressure, you monitor their weight, you monitor how much fluid, their fluid intake, their nutrition intake. You record all these things. You also be taking records of their temperature, their pulse, their temperature, their pulse, like I said, and their weight, and sometimes you also be helping them with their medications. Okay, these are things you'll be doing as a healthcare assistant, because in your role as a healthcare assistant, you will have instruction to follow. There are things that you will be doing that shows that is your role as a healthcare assistant. You also need to understand how to work as a team. You have to work as a member of a team. You have to be a supportive team player. You have to be a supportive team player in a way that you work and achieve the same results. Okay, there's a set goal for you as a team, whether it's in the care home, whether it's in the community, whether it's in the hospital. There's a set goal that you are to achieve, and to be able to achieve that collectively, you have to learn to work as a team. In an interview, you might be asked, how do you deliver on your job? One of the responses that would give you a high score is to indicate your commitment to work as a team player. All right. So you also have to understand that you need to respect the confidentiality of your patient. Okay. By not sharing any personal information on those individuals with whether your family members or your friends. Okay. You also have to ensure that their records, you store them securely. You have to keep them in a safe way. When you are filing records, when they are writing things that are confidential to your patient, you have to keep your filings clear, and you have to keep to the rules and regulations of the care home or the care provider that you are working with. You also have to follow the agreed way of working, because before you start the role of a healthcare assistant, there are confidentiality statements you have to sign. Okay, and on these things you have to read through very well and understand that you are entering into a contract, that there must not be a breach of contract. Okay, so those are things that you have to keep doing. And as a healthcare assistant, you have to also understand what it means to work in a person-centered way. That is very important. Somebody should write that down. Person-centered way. Okay, person-centered way means being able to work in a way that suits your patient. Okay, every patient is unique. When you are asked by the interviewer, for example, that what does it mean to work in a person-centered way, your response should be, a person-centered way is working in a way that suits the patient, in the way that the patient wants to be taken care of. There are some patients that will tell you, oh, okay, in the event that they have a cardiac arrest, they will tell you they don't want to be resuscitated. They don't want to just allow them to pass on to glory. Okay, they will have told you that is what they want. Some will tell you, okay, they are vegetarians, that when you serve their meals, they have specifications on how they want their food to be served. Okay, the type of nutrition that they want. Okay, those are some of the things that you have to learn as a healthcare assistant. You also have to build good relationship with your patient. Okay, you have to understand that while you are dealing with your patient, you cannot look down on them. You cannot say because they're your patients, you treat them anyhow. Because nobody is there when you are taking care of them, you cannot say because nobody is watching you that you treat them the way you like. Okay, these are things you have to know as a professional. Okay, the standard you work, okay, is the same in across all sectors, especially as healthcare assistant, whether in Scotland, whether in England, whether in Ireland. Okay, the whole of UK have the same, have similar working conditions. Okay, now it is very important that as a healthcare practitioner, you have the duty to care for those around you. Okay, that means that you have to behave in accordance with certain professional standards. All right, that this standard is intended to be of, it's not supposed to be, you cannot do things with your own understanding. You have to work in accordance to what the policy of your care provider says. Those are things that you will know during your induction. Okay, it's important that we understand these things and we put it in our mind whenever we are dealing with our patients. All right, this is very important, and we have to make sure that we follow all these guidelines when we are answering questions during our interview. Okay, so now it's important that we also know that as healthcare assistants, okay, we have to engage in contributing activities. All right, contributing activities are activities that are supposed to help in the recovery of our patient. You have to be able to engage in outdoor activities. Sometimes you will need to take your patients on a long walk. Okay, now when you take them on such long walks, it will help their recovery, and you have to be ready to go on such works, so that to help the recovery of your patient. All right, so these are things you might have to do, and you have to show readiness and willingness to do all these things, because as long as it will help your patient, you also have to do them. Okay, in a lot of cases, your employer will tell you safe and approved ways that you are expected to work. All right, you have to follow the policy of the organization. You also have to understand that you will have a manager that you report to. A lot of times your manager will be the one that will give you instruction on what is expected of you from on a regular basis, in order for you to be able to deliver your work effectively. Another important part is that because we are all humans and we can make mistakes. Okay, so when mistakes are made, okay, it's important to be honest. Very important. You have to be honest and you identify where the errors have happened. Okay, this will allow you, okay, so that you'll be able to reduce the impact of the mistake. Okay, then you will take note of this mistake so that lessons that you have learned from that mistake in the course of your work, okay, you will not repeat it again. And when you make such mistakes, you have to tell your manager, report to your manager when you make mistake. Mistake is part of the job. It happens and you are not allowed to cover up any mistake you make. Once you make a mistake, you have the responsibility to report it to you, to whoever is in charge, your manager or your line manager. This is called whistle blowing. Okay, in most cases you have to discuss such concerns that you have with your line manager. Okay, you have to speak to them and let them know that this is what you have, the mistake you have made, so that if you cover it up and they find out, it could result in an issue, and I'm sure you don't want such issues when you are working. All right, so as healthcare assistant, we all have to understand that we have to work in partnership. Like I said earlier, partnership with your colleagues. If you have any issue with your colleague, you must tell your manager. Okay, don't go directly, to start confronting your manager, because your role will involve working with many people, okay, who have different roles. Everybody have their role, their specification. Okay, that is what is called partnership working. Okay, you have to be able to understand that in working with other people, you have to develop good relationship skills that will help you to improve the quality of the care you are providing. Okay, because when you are providing this care, you might even be dealing with the family and friends of the person you are caring for. Okay, you have to work with mutual respect in when you are delivering your care as a healthcare assistant. It's also important that when you are working together with people, you should not underestimate the seriousness of their review. When they give you a comment on how an assessment of what they feel, you have to take note and make adjustment. All right, there is always effectiveness in partnership working. Like I said earlier, that as a care assistant, there is what we call the importance of working as a team member. All right, so partnership working is the key goal, to effective results. All right, for you to be able to deliver effectively, you have to understand effective partnership working. Now, good communication is very important in partnership working. Okay, it is very, very essential that as team players, you have to communicate with each other. Okay, health and care social workers, you must value and respect one another. Like I told you, these are important things that you have to show during your interview. Okay, having belief, you have to have belief. When you're working with people, you have to believe in everyone's ability. That is why before anyone is allowed to come on board, you will have, regardless of the type of training you are coming with, regardless of the type of qualification you have before, for your employers to be confident in your ability, they are still going to give you their own training. And that is why you will still be doing induction and on the job training. Like I said, sometimes, even a lot of times, when you are offered a job, you're going to be given somebody to shadow. Shadowing is when you're starting a new job and somebody who is already used to the job is putting you through on how to go about it, so that you will not make mistakes. They will guide you for a while, so that before they will now leave you to do things independently, so that you will get used to it and you'll be able to perform optimally. All right, that is what is called shadowing. Okay, like I said, health and social care workers must value and respect one another, by having belief in everyone's ability to work together to achieve the common goal, which is good results. Okay, that is very important. There may be times when there will be disagreement, okay, between workers, because you have different beliefs, you are coming from different backgrounds, especially when you are coming from Nigeria, you're coming to a new country like the UK, where you're coming with a different belief system. Somebody who has worked in the Nigerian setting, maybe worked in the hospital in Nigeria, a government hospital, you understand how you use your gloves, for example, is different. When you come to work in the UK, you are not allowed to use one glove more than once. Okay, that is no disrespect. Okay, I'm just saying that it's important that you understand that the work policies are different. Okay, you have to, the type of mentality you are bringing into the UK is different. Okay, you have to understand that you have to leave some of those way of doing things behind, because there's a lot of respect and expectations, for quality and what you call management of resources here. You have to make sure that the patient is at the forefront of whatever you are doing. How to avoid infection in the best way. So there is no room for managing gloves, or aprons at that. Okay, so it is important that you understand that you are coming from a different place and you have to put behind every mentality you have. Okay, you come into a new place and you have to understand that you have to do things the way it is expected of you in this new environment. All right, so it's possible you have disagreements, with your colleagues, okay, because they are coming from different backgrounds. All right, so you also have to give them time you have to allow yourself the opportunity to blend. So in this case, people who are also employing you, they know that you are coming from a different background, so they will be giving you space to support you. They are ready to support you. They understand that you are coming from a different place, so they give you time to support you. If you need advice, you will ask for advice. If you need advice in resolving any conflict, you will get help, because they are always here to help you. You should ask for advice about partnership working or how to resolve any conflict whenever you face any problem. You can ask your manager or your colleagues, that are already familiar with that workplace, so that because they have experience, they've been there before, and they can help you so that you won't make such mistakes, again. All right, so it is important that we follow all these things. It will help us to deliver well on our job. Okay, as healthcare assistants, we don't have a choice but to be always to respect the policy of the organization we are working for, because it's very important that we keep to the rules and the policy of the organization we are working for. Okay, so as healthcare assistant, there are several regulations that we have to follow. Okay, as healthcare practitioner, you have a duty to care for those around you. That involves behaving in accordance with certain professional standard. Okay, when you have the responsibility of some aspects of a person's care, like somebody that has a complex procedure, you have the duty to care towards that person. Okay, you have to uphold the law in the course of doing it. Okay, you have to understand that you can't touch somebody in a way that is inappropriate. Just because you are caring for them doesn't mean you have access to touch them inappropriately. Okay, that is very important. They have their rights, and you have to respect their rights. Okay, part of the duty of a care assistant is to ensure that the residents you are caring for, they receive the highest level of quality care, while also respecting their individual rights. However, very important, there is possible to have conflicts, like I said earlier, but you have to report such conflicts immediately it happens. Okay, you have to remember that you don't try to deal with such situations alone. You have to ask for help when you feel you need help. Okay, that is very important. All right, you have to inform your line manager immediately whenever you are confronted with a situation that is beyond you. Okay, you have to also keep record of relevant facts and dates of any event. Never do or say nothing. You have to make sure you talk, speak out. That is what we are encouraged to do in the UK when you're working as a healthcare assistant. Don't ever try to resolve things by yourself. That will make things worse. Okay, you have to try and get support you need from your manager and from your people around you who are already used to working in that place you are working. Okay, and don't forget, the residents and patients you are caring for, they have the right to comment and complain about you. Okay, the type of treatment you are giving them, if they are not satisfied about it, they have the right to complain. They have the right to report you to your manager. Okay, if you are not giving them the type of care that is in their care plan or how they want to be cared for. Okay, so they have a right. You have to understand that this is their right, so they can complain and they can make report to your manager. That doesn't mean that they don't like you. It's just for you to be able to make adjustments. Okay, now what can cause them to complain? There are many reasons why your patients can complain. Okay, they might tell you, oh, maybe they caution you, oh, they don't like this, and you refuse to make adjustment. All right, for example, imagine you are caring for a patient and your phone is ringing. You're on your phone. You are caring for your patient, you are on your phone. That is against practice, against best practice. You are not allowed to be on your phone when you are caring for your patient. Okay, that is distraction, and that can allow you to do the wrong thing. Or imagine you are trying to give medications to your patient, or you are trying to give them fluid, or you are even watching over them. Okay, and you are on your phone talking to somebody else. That is distraction, and that can be a good cause of complaint about your activity, your role with your display when you are working with them. All right. So one of the most common reason for complaint is communication issues. Because communication is usually the root cause of many complaints. Many people who raise complaint are looking to clear communication with them regarding what has happened. Sometimes simple explanation or an apology can lower the aggravating level of a complaint. All right. Sometimes our ability to apologize and immediately make corrections, when you are working as a healthcare assistant, can reduce the level of complaint that your patient will give to your manager. Unfortunately, I mean, out of 10 people, maybe 5 people, they don't report their concerns because they think that complaining might not solve their problem. But personally, I would prefer that we report. I mean, personally, in my own experience, I've seen that a lot of patients report, and to avoid such reports so that your record will be clean, it's better you make things, you clear the rec the, your you make sure that when you're working with your patient, you don't have issues with them. All right, always clear and try to solve the problem. If it is beyond you, if they are the ones giving you the problem, report the situation to your manager. Okay, because in some cases we've seen some patients who are abusive, to their carers. All right, so in these situations, you don't need to return the abuse. You don't need to reciprocate whatever gestures, that whatever unkind, gestures they are showing towards you. You don't need to reciprocate. You just take records of it, in your notes, and then report to your manager. You have to understand that there might be social and cultural factors which can make people to make some behaviors, but you don't have to retaliate by replying them or by responding to them. Just take records of it. As a healthcare assistant, your role is not to retaliate when you are confronted with such uh, foul languages in some cases, or some behaviors that are unpleasant. You just take records and you report to your manager. All right. Now, there may be social and cultural factors which could act to dissuade people from making complaint. All right, this could include age, ethnicity, sometimes the culture you are from, sometimes religion. Because of your religious belief, you might feel, oh, you don't want to make complaint, but to make your work easier, okay, you have to make such complaint so that everyone that needs to be cautioned will be cautioned. And if they need to change you from that patient and give you to someone else and bring in someone else too, that will be done by the management. All right. Now, talking about the patients that you are caring for now, some of them, they won't even report you. They won't even make complaint about you. It's because maybe they have past experience. That reporting will not make any difference. But that will be not good for your records, because sometimes these things might come back, and in your records, you won't want them to be in your records that you had some bad complaints about you. All right. Now, patients who cannot read or write may be dissuaded from raising a comment or complaint. As they may think that they may have to fill out a form, they will just take it. They will absorb the whole uh, uh, comment in their mind because they feel it's not necessary. And you have to just understand that it's not worth putting your patients through. They are also humans. At some point, they were probably able to do these things themselves. Life happens, and when life happens to them, they find themselves in this situation. And you also have to understand that whatever you can do just to discharge your duty to the best of your ability, do it. Okay, and do your own bit, and then you will have done your part. All right. So how do you handle comments and complaints when they come? Because they will definitely come. Okay, as a healthcare professional, you are responsible for helping anyone who has a complaint. They have to learn more about how to make a complaint, even about you. Let them know, if you want to complain about me, this is the steps you go about. If they need your manager's number or contact details, you have to give it to them. You have to let them know about the process they need. You need to complain. The complaint process itself, you have to give to them. It is important that you understand that complaint handling process. So you can answer. You have to let them understand the complaint handling process. Okay, so that they can answer any questions that patients and family have. Any questions they have, you have to be able to answer for them. Okay, you won't say because they want to complain about you, you won't give them the phone number of your manager, for example. Okay, so in that situation, you have to understand that they have the right to raise complaint when they have complaint about you or the type of services you are giving to them. Okay, now when someone first raises a complaint to you, it's important to remain calm, all right, and professional. Okay, it can be very, sometimes it's easy to quickly want to be defensive. Okay, especially if that person is upset or angry. Okay, now if you now become upset with them too in return, does not make it better. All right, just listen and be calm. Okay, an angry response does not make the complaint go away. It only escalates the situation, and when you escalate the situation, it could result into conflict. Okay, and it will now make the complaint more difficult to resolve in a satisfactory way. All right, so when someone wishes to discuss a complaint, it can help by maybe if you talk to them in a quiet and confidential location, put them in a separate place, talk to them. These are things that can come up during your interview. All right, the interviewer might be asking you, how do you resolve a complaint? All right, when a service user or a patient is giving you a complaint or is complaining about the services you are rendering to them, how do you respond? How do you react? Or they tell you, oh, you are in a care home, for example, and the service user you are caring for is raising complaint about the type of tea you are giving to him. Okay, how do you respond to that? The interviewer wants to see your reaction. Now you tell them, I'll talk in a quiet and probably take them to a confidential location. All right, I will offer them a listening ear, and I will tell them I'm going to make sure that their complaint gets to the appropriate authority and it will be taken care of. Okay? Now, you can even say, in addition, that how do they want it? You have to, that is what your interviewer wants to see. Not that, oh, that the patient is telling you, oh, they're complaining about the tea you have given to them. And you said, oh, take it like that. That we don't have tea. That is the tea available. No. If an interviewer asks you such a question, you will tell the interviewer, you'll be quiet and you will listen to what the patient is talking about. You take notes and you will assure them that you will make adjustments just to suit what they want. Okay, so imagine that kind of question during your interview. You will have answered the way they want. You also need to show empathy, okay, to that kind of person, because empathy can be demonstrated through non-verbal communication. The expression of your face, those are non-verbal communication that the patient is looking out for. You may not say anything, but the way you react, your body language, these are very important way of communicating with your patient. You let your interviewer know that your body language will show empathy. Even if you don't say it, the way your eyes you are displaying your eyes, the way your body is moving, these are non-verbal way of communicating. You have to display appropriate non-verbal, way of communication during such a situation. All right, now you also have, in case you can't handle the situation yourself, you will tell them, okay, I will get my manager to look into the situation and help you and assist you and make such a situation better. So there are formal complaints handling way of handling. There are some ways of handling complaints. That's the formal way. Okay, when someone has communicated their complaint to you, you may wish to raise a formal complaint. You may wish to escalate it onto your superior, maybe your line manager. You have to provide your line manager with all the sufficient information that is necessary for them to understand the complaint. All right, because that is what would make them to be able to deal with the situation effectively. Now, raising a complaint in healthcare, all right, is the same across the whole of England. All right, so wherever you are working, whether in England, Scotland or Wales, wherever you work in England, the procedure you follow to raise a complaint is the same. All these things you will be informed, you will be given the procedure that you would follow effectively when you are doing your induction and your on the job training after you get the job. All right, now furthermore, all right, there are some stages to complaints, the procedure for complaint. Number one, maybe there's local resolution, and when local resolution fails, you cannot take it further to the higher level. Okay, so these are ways you respond to questions that come during your interview that is talking about complaint, how you resolve complaint with your patients and all that. All right, moving forward, unfortunately, mistakes happen in the healthcare sector. I mean, people, we are not perfect. We are humans and we are not robots. All right. So you have to understand that when these things happen, some of the mistakes we make can have adverse effects. All right. And sometimes, apart from adverse effect, some incidents and errors that we make can have some adverse effects also. So there are some near misses. Maybe you are pushing a patient on a wheelchair, for example, and you accidentally, or you almost, the patient almost hits, almost fall or something. You have to record such an incident. That is a near miss, okay? So that what has caused such a near miss to happen can be corrected, so that the near miss doesn't result in the actual incident in the future, okay? If there's maybe the doorway is the always the is too small, to take the wheelchair, or it's too narrow, and then you didn't report it, then maybe someone else in future can now will not even have a near miss. It will probably result in an actual incident. Okay, it is important that you understand how to respond to such situation. Okay, if there is a near miss, whenever it occurs, you have to be honest and open about what has happened. You have to report the situation to your line manager as soon as it is practically possible. Okay, because when you do so, it will allow action to be taken, so that it will reduce the impact of such mistakes, and to allow other people to learn from such mistakes, so that it doesn't happen in the future. Okay, sometimes you have to put it in record, have a detailed analysis of what happened, what was the situation, and what you have done about it. Okay, so these are very important things you have to do to make sure that you, in your job role, you have not putting everything you are doing, you are putting into writing. If there's any near miss, is there any mistake you make, you have to make sure you put it down, so that the appropriate corrections can be done. Whatever they need to do, they can do it, so that you'll be able to achieve the desired goal. Your responsibility, as you'll have done your job role effectively. All right. Now, in the course of this training, okay, I hope I've been able to take care of situations, help you to understand how you can work in an agreed way with your employer, how to know when to escalate your concerns you might have, which I said earlier, that's whistleblowing, okay? You also have to be honest, and also identify where there are errors. Whenever you have any error, when you have any near misses, you have to report it. Okay, you have to understand the importance of working in partnership with others. Okay, this is very important. You have to be able to describe your responsibility to the individual that you are working with, that you are taking care of. Okay, you also have to understand, I hope you'll be able to understand all these things. All right, because these are things that you might be asked during your interview. Okay, how they want to see how well you understand your role, how well your role is clear to you, so that it's still important that you go through a training before you start your role. After they offer you the job, you still do an induction and an on the job training. But before these things, there's going to be so much so much candidates that they will be interviewing. So if you present yourself having display your skills to be able to identify with all these things, you'll be a better candidate. That is why you are having this training. Okay, so in other sessions, I told you earlier that we're going to be having 20 sessions. Okay, this is the first of the 20. All right, the other 19 sessions that is remaining, I'm going to be treating other important topics also, because during your interview you can't be sure where the question will come from. Okay, it might come from disease control and management. All right, it might come from moving and handling, it might come from dignity and privacy. So these other 19 topics I'll be talking about, you really cannot tell where your interview questions will be coming from. But after you have studied and listened to all this training that I'll be giving you, I can assure you that you will be well positioned to perform well in your interview. I've been privileged to be on the panel of a lot of interview. Like I've shared with you some basic scenario questions, and with the type of responses I've given you, and those ones I'll be giving you in other topics too, you should be able to do well during your interview. All right, now I want you to like and subscribe to this YouTube channel, okay, so that when I post other videos, okay, of the training, you'll be able to get notification when the video is posted. This is the first of 19 other trainings that I'll be putting out for you to learn from. Okay, with this training that we've done now, I've covered a lot on understanding your role. Okay, so during your interview, you should be doing well whenever questions concerning your role comes up. All right, so I want you to subscribe. Subscription is free. Just click on the subscription button so that when we put out another video, you'll get a notification that the other training videos are out. Okay, it is free and it's for all of you to benefit from it. All right, so share with your loved ones. Even if you're not in the health sector, even if you're not planning on becoming a healthcare assistant, this is useful for you. Even as nurses in Nigeria, it's useful for you. There is no knowledge that is wasted. All right, now thank you all for joining this training, and I wish you all the best in your endeavors. Thank you, and God bless you.